Hey guys, it's Dr. Watt from Pinpoint Chiropractic. Let's talk about the hip. We see this so often, one of the most common reasons people come into our office. But I want to give you a little bit of background to give you a better understanding of what's going on. And so when we talk about the hip, the textbook answer for hip is going to be your glenohumeral joint, right? That's where your femur comes up and inserts into the pelvis. This is a ball and socket joint. Oftentimes when patients talk about the hip, they're also referring to their SI joint. That's the one where they say right back here. Slightly different joint. We can see how they both play in together and both are related. But for this stuff, we're going to be focusing really on the glenohumeral joint, the true hip within that. And so when we talk about, there's our two bones, we also want to talk about all the muscles that are related there. And so we can see in the deep hip, this ball and socket joint is made to be very mobile, moves a lot. But because of that, there's going to be a lot of muscles around it that then stabilize. And so we can see all these deep muscles and this yellow nerve that we'll come back to in just a minute. The other thing that we're going to see are more superficial muscles. So from the back side, you're going to have things like your glutes that are going to cover up all those deep muscles you just saw. And then from the front side, you're going to see things like your psoas or your hip flexors. Those are all in that area. We can see, once again, some of those nerves and those arteries coming through there as well. We also see that sciatic nerve here that can play into all of these different joints, right? And so there's a lot of things to look at when we talk about the hip. When a patient comes in and says, I have hip pain. Very rarely are they just a simple answer, because we want to rule in each of those muscles to figure out, is this muscle our pain generator or not? Is this muscle weak? Is this muscle too tight? We also want to look at the nerve related stuff, because many hip issues come from the low back, right? The sciatic nerve originates up higher from the lumbar spine and then goes down and across that hip. And so you may be feeling pain in your hip, but it could be coming from higher up in the low back or in your pelvis. So we want to rule in, rule out those issues as well. We then are going to get more ligament type stuff in the hip as well, where we can see some deep ligament stuff, whether it's your labrum or some of those stabilizing ligaments, or some tendinitises as well, where the tendon's getting inflamed from improper motion and stability. All of these things could be contributing to your pain and your dysfunction. So we all start with a consultation where I want you to tell us every single symptom you have, how long it's been going on, where it's coming from, everything you know about it. So that way when we roll next into an orthopedic exam, we can work on ruling in or ruling out those things to get a better definition of what's creating your dysfunctions. Then when we talk about treatment, there's so many cool things that we can do for your hip, right? So in office, we're going to adjust you, get that joint moving well again, looking at both, once again, the low back and the hip itself. We can also work on some soft tissue work, whether that means we do some dry needling to blast some of those trigger points away, doing some shockwave therapy or some laser to help with healing deep down in there too. We're even going to send you home with exercises. We've got laundry lists of things depending on what your condition requires to strengthen and stabilize those different tissues and rebalance them back out as well. So all of those things can get built into your care plan just depending on what you specifically need. Hips don't have to be big and scary. You do have two of them and you got to use them for the rest of your life. So let's figure out how we can take good care of them and get you feeling and functioning the way you should again. If you got questions more about this, come on in. Let's chat about it.